the relationship between the DMRC, which is the Diabetes and Metabolism Research Center, and the DMCE, which is the Diabetes Multidisciplinary Center of Excellence, is that they're really fully integrated. One is the more clinically oriented arm, which is the DMCE, directed toward multidisciplinary clinical care for the complex needs of patients with diabetes throughout their lives. Also has many physicians, nurse practitioners, as well as diabetes educators, not just engaged in clinical practice, but also clinical outreach, relationships with the community, as well as clinical research and clinical trials. And that's where there's a lot of integration with the Diabetes and Metabolism Research Center, which starts sort of with the clinical care and clinical trials, but then reaches all the way back to basic science as well. So there's fully sort of bench to bedside and bedside to bench, if you will, both directions of research as well as clinical care. The DMRC has really taken off, I would say, over the last 5 to 10 years. We've really tried to make a major effort for Ohio State to be doing research all the way to understanding the fundamental causes of insulin resistance and beta cell failure in diabetes for type 1 and type 2, all the way through clinical practice. And having a program that addresses not only the care of patients now and embraces the best technologies and utilization and education programs in that direction, but is also directed toward making things better for the children of our patients and for our family members and the next generations is really, I think, essential to what we view as our mission. We've been really, really lucky to have a fabulous group of diabetes educators, both on the outpatient side, but also on the inpatient side where we have patients who are newly diagnosed with diabetes.
So a diabetes care and education specialist is a healthcare professional, typically a nurse, a dietitian, or a pharmacist. Could be other disciplines, but they specialize in caring for people with diabetes. We not only educate on current technologies and monitoring blood sugar, but we also motivate and we encourage and we help people set goals for themselves that are relatable to them, and it's their goal, and we help them set a plan to achieve that goal to be healthy. Our counterpart or collaboration with the DMRC in that they get the research and the funding, but we come back and we help make it real for people. And so while they're busy doing the research, we're putting that research into practice every day. There's never a good time to have diabetes. Let's face it, I don't think many people would sign up to have diabetes. Yet, when you work with somebody, they can help you put a plan together, make each baby step to get going. And I love that relationship. I love the long term. And when we work well together, the person with diabetes and us, we're talking about relationships that last 10, 15, 30 years.